So now this is 2 weeks after a cervical decompression and a lumbar 2-level decompression and a stabilization. So we did the neck and the back all at the same sitting, and it was all performed as day surgery. And here you are 2 weeks after. First of all, how's your posture?
Posture's great. Very, very good.
Yeah, you're standing up straight.
Yep.
Yeah. Good. Because definitely previously you were tending to lean forward a bit.
What was that?
Yes, I see that very clearly, and we'll probably have a look on the video. Now, can I just see you walking?
Yep.
Good, great. And then the other way? Perfect. All right, and how about some kind of side-to-side movement? How does that feel at the moment? Obviously you haven't done that yet.
I won't go too far.
Yeah, and a little bit of gentle bending forward?
Yeah, that's okay.
Good.
My body's telling me when to stop.
Yeah. Have you had much pain?
I've had some pain down my left leg, but previously it was on anywhere between 6 and 9 out of 10.
Yeah.
And now right now it doesn't hurt at all because I've taken some anti-inflammatories.
Yeah.
But it's between and white. This morning I woke up and for the first hour I had no pain.
Yeah,
and then
good.
The pain starts gently.
Any weakness in your legs?
It's better than it was, and that's come back. Right.
Can you do on your stand on your tiptoes? Good.
And this is reasonable.
That's really good.
But the big thing was that I was always holding my weight onto my right foot, and
now you're balanced out.
Taking the weight on my left.
You're definitely looking balanced. Much pain in the back of the neck? That's where the operation was?
It's sore, but I know from that's where the muscles got
operation.
Got cut.
Yeah.
They get cut or whatever you do.
Exactly.
I can't stay like that for too long. I have to, or I lie down.
Yeah.
Lie down and just support my head.
Okay.
So that works fine.
But that will all
the actual wound
come back.
soreness only lasted about 4 or 5 days.
Great.
That was quite sore, but it's gone.
It's gone. Excellent.